Hi, in this video we'd like to talk about another condition that can lead to possible disorders of menstruation and also recurrent miscarriage among women in their fertile years, reproductive years, in their 20s, 30s and 40s. So this condition is massive ovarian cysts. Now this condition is also treatable here at Antai Hospital with our 414 treatment system, as we mentioned in our previous video. If you'd like the full details of the 414 treatment system, please visit our last video. We go in depth and all details about the 414 treatment system. So massive ovarian cyst is a benign dermoid cyst that is growing on one of your ovaries. Usually we only will observe on one side. It doesn't happen on both sides at the same time. And this dermoid cyst, this ovarian cyst, we call it massive ovarian cyst is because it can grow up to significant sizes of significant weights, which is why the most commonly associated symptom of this condition is a significant pressure in your abdomen, in your pelvis, and also you feel heaviness, some weight there that is pushing down, some pressure. It's due to this cyst. It's the most distinct sign that you can let yourself go for a checkup in case it might be a potential massive ovarian cyst. Now, not to worry, this form of cyst is benign. So it's not associated with any form of cancer of the ovaries, of the reproductive system, nor will this cyst eventually develop into cancer. It will not. However, it can cause some complications that are pretty serious. For example, it can affect your regular menses cycle because it's positioned on the ovaries. Sometimes it's inside the ovaries as well, and it can affect the maturation of the corpus luteum, can affect the quality of your egg cells. Sometimes it can even cause the egg cells to not being released. So this can cause amenorrhea as well. So this form of massive ovarian cyst leads to a form of infertility. You are unable to get pregnant because either the egg cells released are very poor quality, it disintegrates very quickly, being unable to get fertilized, or it doesn't release anything at all. But if you do get pregnant, because of the massive ovarian cyst still being present, it can affect the corpus luteum. So you won't have sufficient levels of progesterone, causing early miscarriage. If it goes on to the late pregnancy, if the cyst is still present, because of how massive and how heavy it is, it can affect the uterus from expanding properly. This can cause a pressure-induced late miscarriage because as the uterus wants to expand outwards, there's a force that's keeping it from expanding, which is the massive ovarian cyst. So this is something that you need to quickly get yourself treated before any pregnancy that you want to go for, and also resume a healthy, normal life, high quality life, so that there's no bulging, there's no pressure in your pelvis. You can have a regular, healthy life. Also restore the menses cycle. So Antai Hospital uses our 414 treatment system and uses 3D laparoscopy. The surgery is pretty straightforward as long as it's diagnosed and it's present. It's all up to our doctors' technique and expertise to expertly remove the entire cyst with no remainders. This way we can prevent any recurrence and ensure you have a healthy menses cycle restored, and then also future pregnancies can be secured and full-term and healthy as well. So get in touch with us via the website, read our articles. This massive ovarian cyst is pretty obvious. You'll see a bulging on your lower abdomen, in your pelvis, and it's very treatable as well. Do not allow it to affect your menses cycle and pregnancy attempts. Get yourself treated as soon as possible.